My name is Bayram. I'm an assistant project scientist at the Department of Neurosciences, Parkinson and Other Movement Disorder Center at UCSD. And I am originally from Turkey. All my training, education background is from Turkey. My research is focused on sex, ethnicity, and racial differences in Parkinson's disease. So Parkinson's disease is a neurological disorder affecting more than 10 million people worldwide, and it is the fastest growing neurological disorder. However, despite being so common, we don't have any effective treatment strategies, and our treatments for the time being are only limited with just giving some relief for the symptoms. We can't actually cure, stop, slow down, or prevent the disease. So my role in research of this disease is to understand how differences between men and women or differences across different ethnicities, racial groups can actually help us better understand what is causing this disease, because we don't know the exact cause of this disease. And eventually, hopefully, such differences will allow us to develop precision medicine, personalized medicine efforts so we can actually cure this disease one day. So my day-to-day at work has shifted a little during the pandemic, but normally in a normal world, I am a rater in a lot of the clinical trials and observational studies that we're running at our center about Parkinson's and other Parkinsonian disorders. So when they come in for a visit, let's say for a drug trial, I'm usually the person that's going through the rating scales with them, making sure they're not having any problems with the drugs, and just making their follow-up assessments to see how things are changing over time. And apart from that, as part of the observational studies, I'm the one that is going through the cognitive testing with them, all the motor examination, the neurological examination with the patients. So I get to interact with both the patients and the care partners and get their side of the stories and fill out the rating scales. And then after collecting all that data, that's going to contribute to multi-site data repositories. I get to analyze that data based on my research question. As I mentioned, I'm interested in sex and ethnicity, racial group differences. Having the chance to interact with such unique people with disorders, because I always think Parkinson's disease and diseases similar to Parkinson's disease, for some reason, impact the most amazing human beings. So every person that I get to interact with through my research is actually the funniest person I've ever met that day. They're so full of life, and it's giving me a lot of hope and energy to actually continue my research and help me become a better person in my personal life too, because their stories are always so inspiring, and I'm very excited to be able to share their stories through my role here at UCSD. I do research with human beings, so no animal or laboratory work per se for me. I actually interact with patients one-on-one and conduct my research like that. So coming from a country where research is not that much supported, I actually looked into opportunities outside of Turkey, and I moved to the States to another institution at first and started doing my postdoctoral fellowship there. And during my time there, I met my current mentor, Dr. Irene Litvin, and following her, I actually applied to become a fellow here at UCSD, and I spent around 2 years as a postdoc fellow here, and then I transitioned into this new role. So it was basically me trying to work with this one amazing person in our field that brought me here to UCSD. I miss the food. If anyone has ever been in Turkey and had the food, they're gonna know what I'm talking about. I miss the food so much. I keep in contact with the people that I want to be in contact with, so I miss them, but I get by. During the pandemic, it's not like we saw anyone in person, even if they were our neighbors anyways. So for me, the biggest part is the food. Other than that, San Diego is one of the most amazing cities in the world, and it's a great place to be at. The weather. You can't beat San Diego's weather. It's amazing during winter and it's amazing during summer. It never gets too hot, it never gets too cold. It's never too humid that you're going to get sick of it. And the fact that it's just by the ocean and it's also so close to the desert. So if you were in the mood for not being near the ocean, you want to have some desert time, just drive for an hour and you're there. I just love being so close to such different options. And obviously the Mexican food too. I think the Mexican food in the city is amazing. And I'm so glad I'm able to have access to all the amazing places even during this pandemic. It has definitely helped keep me alive. I'm very into puzzles, like a typical nerd maybe, but during the pandemic, I actually finished a 1,000-piece puzzle that's all black, no patterns, no other colors. Even the teeny tiny pieces themselves didn't have any specific differences amongst themselves to help me differentiate. So it was basically going piece by piece, testing every piece out to see which one fit with the other. So I did that during the pandemic, and I actually am very, very proud of it and about to get it framed. So I'm a huge fan of that dry humor. So a Parkinson's patient will tell you a joke, it'll be hilarious, they'll tell it with a straight face, and I just love it and I live for it. During every visit, it's one of my goals to make sure the patient leaves with having smiled at least once.